Hi everybody. I'm a star. See that? Because you are. He actually was a star. He was in Harriet the Spy. He was the cat who popped out of the box. He's a good boy. He loves people. He loves going places. He's not an outdoor cat, but lately he thinks he's got to explore the garage, which makes me so uncomfortable. And he's spoiled. Aren't you? I think you're spoiled. I think you are. I think you truly are a spoiled cat. He thinks he owns everybody. When we would have parties, he would think the party is his. When the doorbell rings, he's the first one to go to the door. Right. He's been having some weird things going on with him. He's been having his liver enzymes are up, so he has to take pills at night and in the morning. Yes, because we want him to be around forever and ever, because he's the best cat. Yes. So you probably will be seeing him pop in and out of videos, because wherever I am, he is, unless I'm like going to the store or something like that. But otherwise, he's always with me. He's spoiled. Guess you are. You're spoiled. Right. Kiss, kiss. See, I could just sit here and pet him all day long and cuddle because he's so cute. Right. Okay. We gotta get going. We gotta start the video. I've always had a lot of health problems. I mean, really ever since I was born. The first thing that I had a lot of trouble with was my stomach. And through elementary and middle school, my doctor, my pediatrician would always say, "Oh, it's just stress. She don't want to go to school." That's what he constantly would tell my mom. Well, eventually I started not gaining any weight, and they noticed that I was starting to get a really, really bad S-curve. So I was getting really bad scoliosis, and at that time, they didn't really put two and two together. Stomach, we're talking, 90s when this problem was. Not many people knew much about celiac. Celiac was kind of like, that was scoliosis. They started seeing that, so they sent me to a back doctor who then put me into a brace. So every night I had to wear it, but I only could wear it for I think I only wore it for 3 weeks, because then I went in for surgery for my pectus because my chest bone caved in. So they sent me in for that, and because the bar hung out, I couldn't wear that back brace. So then that surgery was really, really painful. That was painful. They basically took, a bar about this size. They put it in through one end and they put it through the other. I have no clue how they didn't hit my heart or anything, or my lungs, when they went right through. And then they would flip it. So the bar was like bowed. And then when they flip it, maybe this nice. So when they put this in, it had like a bow. So it was like this. Okay? So then when they flipped it, it popped out that way. So then you would get it, it would pop out that way. And then you had to leave it in for 2 years, or 2.5 years I left it in for. Probably should have waited a little longer because it went in, but I'm not doing it again. Then after that, finally, I was diagnosed with celiac disease and colitis. I pretty much, when I first started eating gluten-free, it was just pretty much meat, fruits, and vegetables, and that was it. Because we didn't know, people are saying, we started going to the support group, meetings, and they would keep saying that, well, it's in it's in soy sauce, it's in ketchup. Some ketchups have it, and this was when I was diagnosed with celiac. I was diagnosed way back in like 2001, so this was before like any really good gluten-free food came out. It was all like, ugh, I'm not even gonna talk about it. It was just nasty. That stuff was just nasty. So my mom always had to make everything. After that, I started having gallbladder issues, but the doctors wouldn't believe me. We went back to U of M, we went here, we went there. We had a HIDA scan, which is what they do to track to see how long it takes for the dye to get to your gallbladder. Well, I got it done in my town, and they said it took 6 hours. It was not supposed to take 6 hours. It was only supposed to take 2.5 hours, but mine took 6.5 because my gallbladder didn't work. But doctors still were like, it's not your gallbladder. So then they sent me to U of M, which then they did the same test and still didn't get to the gallbladder, and they still were like, well, I don't think it's really a gallbladder. Eventually, after I had on like 86 pounds, my mom was like, no, you're gonna send her to a surgeon. So they finally sent me to a surgeon, and the surgeon was like, I am 99.9% sure it's my gallbladder. He took it out, and I was feeling so much better. Then after the gallbladder, I started having, after I got the bar out, about a year later, I started having pneumothoraxes, where it's when your lung starts to collapse. And I had that, and it kept going. I think I had 7 pneumothoraxes, and they're painful, and they're very hard to breathe. I've had a couple instances where they were debating on putting a tube in. I think pretty much all of the time I didn't have a tube in, but then I had to go in for surgery for that to fix that. So they ended up going in, and they would staple your lung, and they ended up finding something wrong with my left lung, so they had to take some of that lung. And so I had that. I was in the hospital for 7 days because they have to wait for the tubes to clear, because they had tubes in my lung and all the fluid needed to drain out. Once the fluid was drained out, I could go home, and it was driving me nuts because the doctors would be like, oh, I don't see any fluid today. You'll probably be able to go home tomorrow. And then all of a sudden that night, fluid comes out. I'm like, dang it. So I was in there for about 7-8 days. It was a long time, and I was ready to go home. And then after that, I had hiatal hernia surgery because I was having a lot of heartburn issue, and so we went all over the place trying to figure out why I'm having so much heartburn. And then I started losing weight a lot with it. If you have heartburn, you can't really eat very well. But so then we went to U of M, and they were like, oh, yep, you have a hiatal hernia. So they didn't really want to do surgery there, so they sent us to see a doctor here in town. They did surgery. Surgery went fine. It was the most annoying surgery. I mean, it didn't really hurt. It didn't hurt. It was more annoying because you couldn't eat certain foods. Like for a couple weeks, you could only eat like chicken broth. Then the next week, you could only eat like potatoes or macaroni and cheese. Then you slowly add in meats and stuff like that. But it was annoying because you're so hungry and you're like, I really want to eat something, but you couldn't. Then I just started losing weight for no reason. Well, my stomach was really bad. Like everything would start going through me. What is celiac doing now? So it kept going through me, kept going through. I got down to 54 pounds, no joke, 54 pounds. They were giving me 3 weeks to live. It took, I would say, I think it was eight months to maybe even 10 months before doctors would even listen to me. They kept saying she needs to go to a psych ward because she's got anorexia and blah, blah, blah. And that's all they kept focusing on. And it was like, no, I want to eat, but it just went right through me. I mean, I don't want to give you the disgusting details, but it just went through me. And it pretty much was like you could eat it again. So I wasn't collecting any nutrition. So we dealt with that back and forth. We went to even Mayo Clinic, and they suck. Mayo Clinic is the most horrid place. Doctors are mean as hell, and they wouldn't get over the fact of anorexia. Finally, one night we happened to go to the ER in town, and a doctor was there, and he was like, I really think it's something up with your celiac. So he was opening up a clinic. He figured it out. It was my gastrin gland, which then, called for a couple of weeks of prednisone. Sometimes I think I added a couple more weeks, and then he put me on a really, really strong dose of antacids and a whole 9 yard. But that worked. I started gaining weight, and I got to be able to go to Florida because my mom's like, because when you're only given 3 weeks to live, it's scary. So my mom would keep saying, if we make it through this, I'll take you to Disney World. So I got to go to Disney World, which was the best during my birthday. Awesome. That's all we did at Disney World was eat and eat. And I gained my weight back in 2 months. I started gaining my weight back. A month after I worked with the ER doctor, I got up to 84 pounds. And then when I got back from Florida, I got to like 90 pounds. And then I got up to back to my 105 pounds, which is kind of like where I really can't get beyond that. I've tried, but for some reason my body's like 108 pounds, and that's the highest you're gonna weigh, because I always fluctuate between 102 and 108. I don't know why, but I guess celiac. But anyways, so then within, I think it was 7-8 months, I went in for back surgery. Because my back was really bothering me because of the curve. So I got an X-lift done. I had some really bad bone-on-bone cartilage problems when they got in there, so this surgery helped. But then, because I wasn't in that much pain. Compared to the bar surgery, it really wasn't that bad at all. The day after I got home from my surgery, from back surgery, I was puking my guts out. I got the flu. And so then, in the sad part, it was during Christmas. I had my surgery 5 days before Christmas. No, 4 days before Christmas. Because the day after I got home, I was puking, and I was only in the hospital, I think, one night, I think, 1 or 2 nights. And then I got home, and I was puking, because I got the stupid stomach flu. Because I was on Christmas Eve morning, I was at the ER because I couldn't keep any pain meds down. So after the back surgery, 3 months later, my pain doctor decided, let's try a nerve block. And I did the nerve block, and it ended up irritating the area. Kind of inflamed my surgery area after I got the nerve block, which then made me. And at that time, I was doing a show at a community theater. I was running the light board, so I had to be there. So all week, they treated it for inflammation, but then the weekend came, and my pain doctor office isn't open. So my doctor said, go to the ER, have them call me, we'll get the pain plan going. So I did that, but ended up with a really horrid, mean doctor at the hospital. Just arrogant at all get out. I was still on painkillers from my back surgery. It was only been 3 months. He came in and he was like, how am I gonna help you? Blah, blah, blah. You're a drug seeker kind of attitude. But he just had that arrogance of like, oh, you're only here for drugs. That's all you're here for. And I told him, no, call my pain doctor, because my pain doctor told me to have you call him. And he acted like I didn't have a pain doctor, like I was lying. Like, why would somebody who wants drugs say, yeah, I have a pain doctor. I'm on a pain contract. So that means, without, you can't give me unless it's an emergency, a situation. Why would you do that? Because you won't be able to get anything if you say, well, I have a pain doctor. Because you're on a contract, so they can't just prescribe you pain meds. Unless you're in a car accident and you need it right then and there, but a lot of times they'll have to call your pain doctor and see what your treatment plan is and whatnot. Anyways, blah, blah, blah. Okay, so then he was just being an asshole. And my room was right across from where the nursing station was. So when he left, I overheard him telling the nurse, oh, just get her out. Do whatever you can. Get her out. She's just here for drugs. And the nurse comes waltzing in with, I guess, a muscle relaxer. Because I kept asking her, what is it? And she's like, well, it's not no narcotics. This isn't it. And she just gave me attitude about that. She came in already in the syringe. And I'm sorry, I'm still pretty upset about that whole situation. She came over, she's like, put your pants down. And I kept asking her, what is in it? What is it, you know? And I know that the doctor kind of was mentioning, well, the only thing I'm going to give you is a muscle relaxer or something to that effect. So I thought, well, it probably is the muscle relaxer. And I kept asking her, she's like, well, that you don't need to know, it's not narcotics kind of thing. And she kept saying that it's not narcotic. She just literally said, pull down your pants, which I did. She stabbed it, and I'm no joke, and I'm not exaggerating, stabbed it like a horror film into my leg. She didn't clean the area. She didn't do anything. She just went, that was horrid. That was horrid. So then she left, and she's like, don't come back for this ever, you know, you can't come here for this. Don't ever come back. And she leaves the room. And then probably 25-30 minutes, the asshole doctor comes back and says, oh, well, I did get a hold of your pain doctor. He kind of acted surprised, like he was surprised that I actually had a doctor. And he's like, well, I got a hold of him, and he ordered blah, 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 but I don't feel like you should have this. But I'm like, at that point, I'm like, well, if that nurse comes back in, I don't want a shot, so never mind. I don't want that stabbing, no cleaning, possible MRSA. She should have just been canned right then and there. Luckily, a different nurse came in, thank Jesus Lord, and then gave it in the right area where your hip is, and cleaned it, whatnot. She was really nice. But then after I left the hospital, that morning, the following morning, I woke up and there's like a huge bruise from my kneecap to my about mid-thigh. It was just bruised. It looked like somebody hit me with a baseball bat hundreds of times. So we went back to the ER, and they were like, okay, well, maybe it's an allergen to the medicine. So they said, just take some Benadryl, So they did that, and then 3 or 4 days later, it started getting blood to the top of the surface, and I'm like, this is really weird. So my mom and I thought, oh my God, because my grandma had MRSA. Oh my God, maybe it's MRSA. So we went back into the ER, and they were like, The doctor looked at us like, I have no clue what is going on. Absolutely no clue. They thought, okay, well, maybe it is an infection. So then they prescribed me some antibiotics, and then they sent me home. I took the antibiotics about 7 days, and it was getting worse. It was spreading, it was getting worse, and the pain was just unbearable. And so then my mom's like, well, they did it, they need to fix it. So we went back to the ER, and again, they had no clue. They've never seen something like this. It was weird, because it looked like a burn would. You know how when you put hot water in your hand after you dump macaroni and it kind of bubbles? It was like that, but it had blood and it had green. It was just weird. And the antibiotics, so they prescribed it a stronger antibiotic. Anyway, so I went to the ER probably at least maybe 15 times trying to figure out what the hell is going on. And my primary care doctor was like, I have no clue either. Finally, one ER doctor's like, why haven't they sent you to a wound clinic? So they sent me to the wound clinic. The wound clinic doctor had to peel off all my skin layers. It was bad. And they had to peel, and then they had to dig out all the dead tissue. So, there was a lot. And they kept doing it to the point where they're like, you're going to need surgery. There's no way, because I'm in so much immense amount of pain while they're digging the dead tissue out. So they're like, you need surgery. So they sent me into immediate surgery to remove all that dead tissue. And he did say that I had staph infection and some MRSA. I came out of surgery with this wound this big. And it was that so deep I could see my bone and my tendon and my muscle. It was gross. And then they put a wound vac machine on it to suck out and keep it clean. So then after that, then I had to have a home care nurse that came in twice a week to, change the bandage. And the wound vac machine was so annoying because it was so loud. You couldn't sleep at night because you would go eek, eek. After the surgery, I'd have to have a home care nurse that would come to my house twice a week to remove it, which was the most painful thing because they stuff. So you got this like deep hole in your thigh, and then they pack it with foam. Like they pack it with this really rough, foamy stuff that if you actually cleaned your skin with, it would rip your whole skin. It was so rough. They would cram it in there, and then when they have to change it, they have to pull it all out. And at that point, the skin, there's like pieces of this, new tissue or tissue that grows into the foam. So then when you lift it up, it's so painful. It's like ripping off a scab really fast. It was so painful. So I had to have that. I did that for a good, I think it was 5 weeks of that. And then not only I had to do it at the wound clinic, and then the wound clinic would have to debris it. So they would go in and scrape out any of the dead skin every week. And I was pretty much at the wound clinic for a good 3 hours every week. It pretty much took my whole summer. And the weird part was, like, the hole was shrinking. I mean, it wasn't shrinking nicely. It was shrinking, but it wasn't healing correctly, but it was still healing. But my pain was getting worse. I mean, so worse. Worse than pain that I've never experienced in my life. And I have experienced pain. I've had so many surgeries that were so painful. But this tops it. Like, the pain just was getting worse. And I kept telling the doctor, I'm like, my pain's getting worse. And the crappy part of this whole thing was my pain doctor was starting his own pain clinic. So I had 3 or 4 months of no pain clinic, right? I had nobody, because I still couldn't keep contact with him. He was running, so I had 1.5 months of completely no pain med, and then another month of him using a buddy of his clinic to treat some of his patients, but it wasn't like you could get a hold of him. So I was going no pain clinic for a while, and then my pain was getting so much worse. But then my pain started spreading, and I had no pain doctor. And then it started going to my other leg, and then it started kind of going up my thigh. I'm like, what the hell? And then, they were giving me, crap load of Dilaudid, and that wasn't even touching. I mean, it wasn't touching it. Not at all. And I'm freaking out, and I'm like, oh my God, I can't sit, I can't sleep, I can't stand, I can't walk, it just hurts. Like, the wind would, just a little tiny air that would blow, it would just be like, Jake, stop. Nothing was working, and I was freaking out because nothing. I couldn't, you know how when you're in so much pain, you just lay down and you just close your eyes and you're just like, sleep. I couldn't even do that because it hurt. Wind, touch, showers were miserable. I mean, everything was just plain miserable. I mean, noise would even make it worse. It would make it throb and burn. Oh my God, the burning was so bad. It felt like I was on fire. And it was getting worse to the point where it was scary. And it got to the point where pretty much I was ready to jump out of a car. And I tried. And my mom pulled me back and was like, no, we'll get this figured out, don't worry. And I'm like, I can't take this any longer. I'm serious. I can't not take this any longer. So finally my pain doctor got his clinic running. We went in. He did a sympathetic nerve block, and it immediately took all my pain away. It completely took it away. And he's like, you have reflex sympathetic dystrophy. And I had it pretty bad. So he did the nerve block every week. I did one block every week. I think it was for a couple months, which helped a lot. And then he decided, let's try ketamine, because studies been showing that ketamine has really stopped the progression of it, and it really helps the pain. It helped a lot too. It helped it enough so then we can do every other week. So I did it every other week for about 1.5 years, right? Or no, it was a year, I think. And then we then I started doing pretty good. So then we did it every 3 weeks. And I think I did that for 3 years. 2 or 3 years? Maybe 1, 2 years? Something to that effect. And now I'm every 4 weeks. So my RSD, let's say it isn't wonderfully better, but it isn't worse. It's a lot better in a sense that it's more controlled. But when I have a flare, I have it. When I'm really tired or stressed out, I have it. The weather is really bad on it. But yeah, that's my story of like my health problems. I mean, and there was other things, like I had to have a few sinus surgeries because I had an extra sinus which was causing really bad headaches, and I had that, and then I had my tonsils removed, and last year I had my appendix removed, and which was not really good with having RSD. So that was my health story. Woo, fun, right? Hopefully no more. Hopefully I am done. No more. No more health problems. God always gives you what you can handle. I've handled enough. No more. But, you know, when I look at, you know, people out there that are worse off than me. So, I hope you kind of got an idea of, like, what I've been through. I'm planning on, like, talking about different products I like and different products I didn't like, different recipes. And feel free to, you know, chat with me